Well, that's right. And if you remember, during the COVID pandemic, we had much less of these viral infections. We didn't really have winter surges in Australia. A year ago, actually 18 months ago, you had a winter surge 2022, and then again in the winter 2023. In China, they've just recently opened up. They had a number of restrictions in some cities, some of the time at least. And I think this is the first winter surge after the relaxation of COVID measures. And so it's maybe the return of these viruses. There's more going around, and unfortunately that means more children getting sick and in hospital in some cases, unfortunately.
So when you said the return of viruses, it's really the sort of viruses that many people did not pick up because of the isolation of COVID and the measures that people were taking to try and prevent COVID.
That's right. So influenza, respiratory syncytial virus, those two are major causes of respiratory illnesses in children every year, but not so much in the pandemic period because of face masks, because of social distancing and whatnot. And then in China, there's obviously other viruses as well responsible, other respiratory viruses. Sometimes coughs and colds can be very mild. And then occasionally, even just what you might think of as a cough and cold can land a child in hospital if they're unlucky. And on top of that, there's also reports of a bacterial infection, Mycoplasma pneumonia, which is it can be nasty. And it's not quite clear why there's so much of that in China at the moment. That's not something that we tend to hear so much about.
And that is quite fascinating. But then the good thing, if it is bacterial, then it could be treated unlike a virus.
Well, that's right. But there's also reports, unfortunately, that there's antibiotic resistance in some of these cases. So that means the doctors have really got to be on top of things, firstly, to diagnose the right pathogen, the right bacteria, and then secondly, to give the right kind of antibiotic that can successfully treat it. And so it's complicated. But in terms of the scale, the reports are that this is a typical winter surge. It's not out of the ordinary. If you remember, in Australia, there were large winter surges 18 months ago and then 6 months ago. This is probably like that. It's a large winter surge, but it's not an extraordinary level.
Yeah. So do you feel China can cope when you're hearing of these high numbers going to hospital?
Well, I think anywhere in the world will struggle to cope with a winter surge. And unfortunately, that's because many parts of the world have relatively weaker hospital systems. In Australia, I think hospitals struggle to cope when there's a lot of children that need admission to hospital in a short period of time. So it's unfortunate. I'm sure in China, some hospitals will be fairly full. Hopefully, they can make more space. And the fever clinics will help as well to triage some of those children and keep them out of hospital. But winter surges are a challenge every winter in many parts of the world, and no different in China.
How surprised were you that the World Health Organization actually publicly said that it had asked China for a bit more data on this?
Well, I think this was triggered by a report in the ProMed mailing list. Remember, 4 years ago, the ProMed mailing list published a report in December 2019 saying there's undiagnosed case of pneumonia in China. Maybe we should be worried. And it turned out to be COVID. Now, the ProMed mailing list a few days ago issued a report saying there was undiagnosed pneumonia in children in Beijing and elsewhere. And I guess that made a lot of people sit up and worry. What if we're already going to have another pandemic? Fingers crossed, and so on. But I think the terminology was unhelpful because China's never said that there were undiagnosed cases. They've said they got influenza, other known viruses, and this Mycoplasma pneumonia. There's no concern, at least in China, about this being a novel pathogen. So maybe the ProMed mailing a list post, maybe that was what triggered the concern, and that's what made the World Health Organization ask for more details. And they issued a statement that the WHO said they're very reassured by the response from China that this is all known things, it's a known winter surge, and it's not even at extraordinary levels. So nothing particular to worry about.
Okay, interesting. So, if it is a known sort of pathogen, a known surge, are there concerns it could spread beyond China?
Well, everywhere in the world we'll have winter surges in the winter time. Where I'm based in Hong Kong, there's a lot of concern at the minute that we're going to face a winter surge for similar reasons. Whether or not it's the viruses come down from China or come in from somewhere else, we know in the winter there's the potential for spread. So I suppose everywhere in Southeast Asia is now on high alert for maybe an upcoming winter surge. Whether or not the viruses come from China, I don't think is really the key question. The key question is whether we're prepared for a surge in children getting sick with coughs and colds, some of those needing hospitalization, unfortunately.
Yeah. Ben, interesting to talk. Appreciate your expertise. Thank you.
Thank you.